Hi, and welcome to the presentation. This is the rule of threes. To begin, postpartum hemorrhage is a serious and potentially life-threatening. When choosing a relevant framework in the literature, down a median structure process. Let's take a look at our problem statement. Frequently triggered by uterine atony. When selecting criteria for studies in this review, participants were in ASA physical. Let's review the research question that guided this search strategy. In parturients, the Prisma flow diagram guided the literature selection process for the inclusion and exclusion.
Results and discussion. Establishing a low-dose oxytocin regimen in cesarean deliveries. Budwick et al. Found that lower doses of oxytocin 0.5 to 3 units were effective in achieving adequate uterine tone during elective cesarean deliveries, suggesting that routine administration of oxytocin greater than 5 units is not recommended due to associated risks such as hypotension and tachycardia. Bhattacharya et al. Discloses hemodynamic considerations of intraoperative oxytocin administration while validating that IV boluses of 3 units can achieve adequate uterine contraction through dose-dependent timed inquiry. Comparing a low-dose regimen to current standard practice. Kovacheva et al. Found no differences between groups in uterine tone, maternal hemodynamics, side effects, or hematocrit changes, with an overall decrease in oxytocin use with the rule of threes oxytocin algorithm. Kotra et al. Found adequate uterine tone was established within 3 minutes. Through dose-dependent timed inquiry, this study decreased undue doses of oxytocin while mitigating adverse effects utilizing the rule of threes. Authors' conclusions. The present literature recommends adherence to a fixed low-dose oxytocin protocol to preclude excessive oxytocin use while allowing the systematic inclusion of other uterotonic agents as clinically necessary during the 3rd stage of labor. The rule of threes oxytocin algorithm was non-inferior to a continuous infusion of high-dose 30 units of oxytocin, and that adequate uterine tone was achieved with significantly lower doses when compared to standard practice. A low-dose IV oxytocin bolus protocol is a safe and effective alternative to a continuous oxytocin infusion. Strengths, limitations, and challenges. All studies share strengths in including participants with shared characteristics among the groups. This ensures highly reproducible research with detailed standardization to authentically replicate clinical practice. Additionally, each study provides level 2 evidence and carries a low risk of bias, increasing the reliability and validity of the present research. Common limitations across all studies were relatively small sample sizes. All studies accepted the absence of reliable measurement tools. However, no clinically validated objective uterine tone assessment methods are available. Ethical considerations regarding administration of rescue uterotonics may confound results. Wide open oxytocin infusions may lead to various amounts of oxytocin infused across all studies. Authors' recommendations. Implementing the standardization of low-dose oxytocin administration in the perioperative setting for elective cesarean sections is recommended. The rule of threes oxytocin algorithm is an excellent illustration of utilizing a low-dose protocol. Based on the available literature, implementing the rule of threes oxytocin algorithm answers the PICO question by showing that low-dose oxytocin is non-inferior to wide-open oxytocin administration. Implications for practice. The literature recommends adherence to a fixed low-dose oxytocin protocol to preclude excessive oxytocin use while allowing the systematic inclusion of other uterotonic agents as clinically necessary during the 3rd stage of labor. Results revealed that the rule of threes oxytocin algorithm was non-inferior to a continuous infusion of high-dose 30 units oxytocin, since adequate uterine tone was achieved with significantly lower doses when compared to standard practice. A dose-dependent timed inquiry is recommended to reduce undue doses of uterotonic agents, thereby minimizing avoidable adverse effects associated with their use. Implications for research. Nurse anesthesiologists can further ensure responsible integration of the rule of threes oxytocin algorithm through rigorous scientific inquiry and empirical validation. While preliminary research findings are promising, conducting further prospective RCTs with adequately powered sample sizes is imperative to confirm the safety and efficacy of the rule of threes oxytocin algorithm. Therefore, this study must be replicated across diverse populations in intraoperative settings. These are our references.